Why is the NHS, a beloved institution, a critical pillar of British society, a mess? Is it, as somebody has suggested on the comment section, a conspiracy? Is it a plan, a deliberate sabotage, like throwing your shoes into the machine to ensure that that private medical care becomes the norm and the NHS is reduced to a non-existence? I don't believe in such conspiracy theories. I believe instead it's much more likely to be a result of the problems are a result of incompetence, the overuse of bureaucracy, and the mismanagement by senior managers. So the idea that the NHS is deliberately destroyed, this narrative thrives on anecdotes of service degradation, underfunding, outsourcing, and an attempt to see all these as interconnected. The problem is it's not interconnected. While ideologically motivated individuals may prefer a privatised model, there is no cohesive, deliberate plan to dismantle the NHS. And more than that, if there were, then the private system would be managed significantly better than it is. The private system is yoked to the NHS already, and it doesn't work well. What we see is a failure of the entire system of healthcare in the UK, rooted in poor decision making and a lack of accountability, and a desire to point the finger at other faults than their own. The importance of NHS England, this huge building in the middle of London, is really the reason why the NHS is a problem and why the health service as a whole, private and public, is such a mess, because there is too much obsession with protecting its back and not enough obsession with putting the public at the front. So the NHS employs over 1.3 million people, yet only a fraction of those are frontline staff. The rest are bureaucrats managing processes, targets and paperwork, and many of those bureaucrats, many of them are people who wouldn't get a job anywhere else. While administrative roles are necessary, the explosion of middle management has led to inefficiency rather than effectiveness, where the only thing that works well is the efforts of the NHS England to avoid litigation, either by limiting the time in which somebody can make a claim about negligence. It's 2.5 years, by the way, or in fighting any whistleblower, making sure that not only is their case rendered useless, but their lives and their own careers are destroyed in the process. Take, for example, the case of Nick Hume, the two-job CEO overseeing Colchester and Ipswich, and at one point even being touted to run Norfolk and Norwich hospitals. While his competence is not necessarily in question, the practicality of one individual managing multiple struggling trusts must surely be in question, and being paid for each. Under his leadership, staff disputes over pay and outsourcing have festered, and there was a question about his not paying people properly for the jobs that they were doing on Boxing Day. That came out in the news on Boxing Day. On the following day, on the 27th, he was interviewed on the BBC, on the Today programme, and yet that was simply a puff piece about how he does Christmas rounds in Colchester and how the A&E is working so well. For some reason, glorified by the BBC, the real issues of Unison's concerns about back pay, it paints a picture of care under Nick Hume, but this obscures the failures of the system under his watch, like delays in pay adjustments for healthcare assistants and controversial outsourcing plans. The problem isn't that there's some sort of conspiracy to destroy the NHS. The problem is that the NHS is in the hands of twits. Unison's claim that healthcare assistants at Colchester and Ipswich hospitals were underpaid for years highlights a glaring issue that should have been dealt with, and dealt with not just by the Colchester and Ipswich hospitals or by Nick Hume. They should have been dealt with by the journalists in the BBC. Why did they give Nick Hume, when he was invited onto the Today programme, such an easy ride? Staff performing duties like cannulation and blood monitoring, a Band 3 role, were stuck on Band 2 wages. This isn't an isolated incident, but a microcosm of a wider problem: undervaluing the essential workforce while rewarding upper management disproportionately. How is it that a nurse who is on such a low pay, who doesn't have parking rights, who has to walk into work having parked her car or his car 30 minutes away, is then on lower wages than they deserve? This doesn't make any sense when managerial staff working in NHS England are sitting pretty. Undervaluing the essential workforce while rewarding upper management is wrong. The pay disparity. CEOs like Nick Hume earning a 6-figure salary, while porters, cleaners and healthcare assistants who work jolly hard struggle to make ends meet. And Nick knows this. He worked as a porter. Despite evidence showing outsourcing rarely benefits patients or taxpayers, trusts persist in privatising experiments, creating profits for shareholders but chaos for staff and patients. And even when agreements are reached, such as back pay for health assistance, implementation is often riddled with delays and disputes. And the BBC's portrayal of Hume as a hands-on, compassionate leader exemplifies how narratives are shaped. This puff piece ignored the glaring contradictions: a CEO celebrated for Christmas rounds while staff are fighting for fair wages. Media complicity distorts public information, public perception, while it's harder to hold leadership. That makes it harder to hold leadership accountable. The NHS faces a crisis, but not a deliberate destruction. Rather, it's a death by 1,000 cuts. The chronic under-recruitment of nurses and doctors and support staff strains the system. Trusts are stretched thin, juggling outdated infrastructure, massive waiting lists, with the political pressure to deliver results, the absurdity of targets. And frontline staff, as a result, are exhausted. They face burnout, with strikes becoming a last resort for those fighting for basic respect and fair treatment, while they see that management and people in NHS England are raking it in and doing more than one job and not doing it well. And amid this chaos, the NHS endures, a testament to the dedication of its workers, not its leadership. Its leadership puts forward the obsession with itself. Its workers put forward a dedication to us. We need to value frontline workers appropriately. We need to balance the pay structures so that somebody who has got their scalpel poised to to penetrate your abdomen is not going to be paid less than somebody who is making bureaucratic decisions up at the top. We need to reduce bureaucracy. We need to streamline middle management. We need to focus on outcomes rather than paperwork. We need to preserve the NHS's public ethos and prevent the erosion of its core values through profit-driven outsourcing. We need to ensure that CEOs and management are held genuinely accountable, that they're held to measurable standards of improvement rather than media-savvy optics. The NHS is not destroyed on purpose. Its bureaucracy, its misplaced priorities, its leadership failures thoroughly account for the reason why the NHS is on the rocks. It's eroding its foundations because it's not putting the people first. It's putting these systems before the people. We shouldn't fall prey to conspiracies, but instead focus on the real culprits: incompetence and structural inefficiency. And only then, once we recognise the problem, can we begin to rebuild this vital institution, because at the moment it's not fit for purpose. And I certainly don't trust it. I don't know if you do, but I don't.